What's going on, all of my healthcare brothers and sisters? I hope that you are having a wonderful day. The BLS 2 Rescuer Megacode is a set of guidelines on how to provide CPR and the use of the AED. This code was developed by the American Heart Association and provides step-by-step instructions for rescuing someone who is experiencing cardiac arrest. In this video, we're going to discuss the steps involved in performing CPR as well as using that AED. We're also going to be providing a video demonstration on how to use these procedures together. Let's get started. So the following scenario is one in which you will be given when you're doing Adult 2 Rescuer BLS Megacode. It begins with you are two bystanders who witnesses an adult collapse. The person is unresponsive and not breathing. Demonstrate to me what you are going to do next. Is it number 1, initiate cardiopulmonary resuscitation, CPR. 2, check for responsiveness. 3, check for scene safety. Or 4, leave the person and come back later? The correct answer to this is going to be 3. We're going to check for scene safety because, as you know, if the scene is unsafe, you're not going to be able to perform effective CPR. These are the steps that you're going to follow when we are looking at a victim assessment with our basic life support according to the American Heart Association guidelines. Number 1 is you want to check for scene safety. If the scene is not safe, move that person prior to starting any kind of interventions. Number 2, you want to check for responsiveness. You're going to tap the person on the shoulder and shout, "Are you okay?" If that person does not respond, then you are going to activate the emergency response system by having that second person go call 911 as well as look for an AED. An AED is extremely important because it is going to identify any kind of shockable rhythms and help you shock the patient and hopefully save their life. You also want to check for breathing. Look for visible chest rise as well as fall. At the same time, you're going to want to be looking for a pulse. You're going to place your 2 fingers on the inside of the patient's neck at their jawline and palpate the carotid pulse for no more than 10 seconds. You will be doing both breathing and pulse simultaneously. After we have performed all of these steps, if the person is still unresponsive with no pulse and no breathing, what are going to be your next actions? Are you going to initiate cardiopulmonary resuscitation, also known as CPR? Are you going to wait for that second rescuer to arrive with the AED? Are you going to start rescue breaths, or are you going to leave the person and come back later? The last option is never the best option. What I will suggest, though, is that you immediately start cardiopulmonary resuscitation because, as we know, this person is experiencing a cardiac arrest. So now we begin the intervention portions of our BLS, and that is chest compressions and airway. We begin with chest compressions, and with the adult, we want to make sure that we are performing high quality chest compressions, as you can see behind me in this image. Hands should be placed on the lower half of the sternum, and you should be compressing at a rate of 30 compressions at about approximately 100 to 120 compressions per minute. You want to make sure that you're compressing down at least 2 inches or 5 centimeters on the adult. That might be on your test. And you also want to complete chest recoil after each compression. So what's different with the 1-person rescuer versus the 2-person rescuer is you have the resource of having a second person. While you are doing chest compressions, that second person can be providing adult rescue breaths. You want to give 2 breaths with a barrier device. As we know, COVID is rampant, so you really want to make sure you have a barrier device unless you know the person and you're comfortable providing mouth to mouth. Each breath should be given over 1 second, and you want to make sure that you can visibly see the chest rise and fall with each breath. You're going to resume compressions in less than 10 seconds. So if you stop to provide those 2 rescue breaths, you want to make sure that you are not waiting more than 10 seconds. You will need to perform at least 1 to 2 rounds of high-quality CPR every single time. So let's talk about our good old-fashioned automated external defibrillator, also known as an AED. That second person, when they arrive as you're doing chest compressions, should be starting to put the pads on those patients. This is the steps that you're going to want to follow when the AED arrives. Turn on the AED and follow the prompts. It is going to tell you what to do. Correctly attach the pads and plug in the connector. When you look at the pads, they're going to have a little picture on them normally that shows you where they should be placed. Make sure that you remove any barriers, including medication patches, water, as well as clothing, before you place the pads. Number 3, you want to clear the patient so that the AED can analyze its heart rhythm. You're going to stop chest compressions and you're going to call out, "Stand clear." Once everybody is clear, you want to push the button and allow time for the analysis. If the AED advises that a shock should be delivered, again, you want to make sure that everybody is clear from the patient. Once you have seen that everybody is clear from the patient, then you're going to hit the button and immediately begin CPR. Make sure that when you deliver that shock, that is your next step. That is the most important thing that you can do for your patient before you do any kind of pulse check. Do at least 1 to 2 more rounds of high quality CPR. So that moves us on to our next question. After a shock is delivered, what are you going to do next? Are you going to, number 1, check for a pulse? Number 2, start rescue breaths? Number 3, resume your cardiopulmonary resuscitation, also known as CPR? Or number 4, you're going to wait for the ambulance? Like I said previously, you want to immediately resume cardiopulmonary resuscitation. Not every shock is going to redevelop a heart rhythm. So you want to make sure that you're giving your patient the best chance for survival by making sure you do those high quality rounds of CPR before you check for a pulse. The most important thing when it comes to 2 rescuer CPR is that you want to be able to switch roles. Somebody shouldn't be doing CPR the entire time. Somebody shouldn't be doing rescue breaths the entire time. After each round of CPR, which is usually like 5 rounds of compressions or every 2 minutes, you're going to want to switch those roles. So whoever was doing rescue breaths will now do compressions, and whoever was doing compressions would now do rescue breaths. That is how you are going to pass your AHA BLS 2-person Megacode. The scenario has concluded. I hope that this video was helpful in understanding how to pass the adult BLS 2-person Megacode. If you have any additional questions, make sure that you leave them down below. I love answering your questions. Head over to www.nursechung.com where I have additional Megacode scenarios as well as resources available to you to help you pass your AHA exams. And as always, I will see you in the next Megacode video. Bye.